Thank you very much for a nice introduction. Dear audience, I'm Dr. Željko Jeleč. I'm an orthopedic surgeon and I come from Croatia, from Zagreb, St. Catherine Specialty Hospital. I'll say a few words about some problems, possible complication of prolonged bisphosphonate therapy. My disclosure, I have no conflict of interest. The current surgical treatment in children with severe types of OI is correction and stabilization with intramedullary telescopic nails. Today's state of the art is fascia dual nail, but sometimes we have a situation where patients are treated with prolonged bisphosphonate infusions without surgical treatment, and that is a very good base. It could lead to some potential very serious side effects. The most often side effects of this kind of treatment is delayed osteotomy healing and atypical femoral fractures. The main purposes of our study were to show or to present a novel side effect of prolonged bisphosphonate therapy without surgical intervention. We also wanted to show morphological changes in intramedullary anatomy. We wanted to identify some surgical problems very close connected with these changed bone anatomy, and of course we wanted to give some advice or to suggest possible solutions, possible technical solutions. Inclusion criteria for our study were severe type of OI, severe deformation of long bone, that means more than 50 degree of antecurvatum or procurvatum deformity, and also more than 50 degree or of varus deformity. Also patients with prolonged treatment with bisphosphonates, and the last but not the least, patients without prior surgical treatment. We reviewed all preoperative radiographs, and from these radiographs we measured and calculated the percentage of sclerotic part of bone. What is exactly intramedullary sclerosis? I'll try to show on that X-ray. I'm not able to show that. You can see the proximal part of the bone, and this is normal color of the bone. Okay, doesn't matter. On this proximal part, you can see white color. That means that in this position, in this region, inside the bone, in intramedullary canal, is hard sclerotic bone. Normal bone, this part is filled with soft spongious bone. On that, on the left side of the slide, you can see cross section, and there is approximately 30 or maybe 40 degree of diameter is filled with sclerotic bone. We had 11 children with 21 segments without previous surgery, and out of these 11 children, we found 17 segments in 9 patients with a significant amount of intramedullary sclerosis. That means more than 50% of whole diameter. I should say that all patients, all of these patients included in our study, were previously treated in another country, not in Croatia. If we talk about percentage of intramedullary sclerosis, on that graph you can see that till the 15th infusion or 15th cycle of pamidronate infusion, the percentage of intramedullary sclerosis decreased, and then after 15 infusion it starts to increase. The same, very similar situation is with the varus deformity also. I mentioned some surgical difficulties during the operation. First of all, if we drill bone, intramedullary bone, when we achieve this sclerotic part, the tip of the drill will go in false route, and that can lead to very serious complication. Bone actually could explode. We can have splitting the bone. That can, for consequence, we have at the end very bad or improper implant position. We have our tips and tricks how we solve these problems. Maybe interesting is that to make bone straight, sometimes we should excise the part of the bone, and you can see on these two X-rays two examples, two different, one triangular and one trapezoidal bone block, which we excise from the original bone to get a straight position. In conclusion, I want to say that the main therapy of OI, the cornerstone of the therapy, is treatment with bisphosphonates. But we should think about some possible side effects, and the novel one we showed with our study. This is intramedullary sclerosing. All of us should decide for yourself when to start with the surgery, but according to our results, the threshold when we should take in consideration surgical treatment should be 15 infusions of bisphosphonate. Thank you very much for attention, and best regards for my country.
Thank you.